My name is Dr. Eduardo Celades. I am the Chief of Health of UNICEF here in Nigeria. I am originally from Spain, and since I was like 12 or 13 years old, I wanted to be a medical doctor and to really go to conflict to help, right, as a medical doctor. So this was my dream when I was a teenager, and I went and I tried to do it. So then I went to medical school. I did my residency and my specialization. I got a master's as well in public health. I learned 4 languages that I didn't have. And when I felt that I was ready, I started to fulfill my dream. That actually was to go to places when there are needs and they need help. So since then, I have been working as an aid worker, as a medical doctor, and then in coordination roles and leadership roles for almost 20 years. And I have been, I don't know, in more than 60 countries maybe, in humanitarian situations or crises, where if you look to the needs of a child, it will not be only health like vaccines, it will be as well having water, or having a toilet, or having schools, right? So I focus on my sector, on health, and within that as well, I need to prioritize, right? Normally what we do to do that is to support primary health care, because most of the needs of a child can be addressed with very simple things, right? With a cold chain, a vaccine, maybe a nurse or a midwife to have a safe delivery. So we need to focus on the things that you can get more impact with less resources. We don't want to do like brain surgery in a refugee camp, for example. We need to do interventions that we know that are going to save lives. For example, vaccination. Measles vaccine is going to save a lot of lives in a crisis, in a refugee camp. So we need to prioritize. Having safe water, for example. So normally it's what I try to do. Every time that I see like different options or a lot of work, is like, what is the one single thing that is going to have more impact to save lives? And normally it's for health, it's like safe deliveries for the women, so like they can have like a safe delivery, and for children it's like vaccination. We as UNICEF, we are working in 7 states as the humanitarian states. They are like in the northeast, what is Borno, Adamawa, and Yobe, then the northwest, like Sokoto, Kebbi, and then as well in Benue, because there's a lot of displaced people. One of the main issues is like the lack of water, and this results in a lot of disease, like diarrhea, and even outbreaks, like cholera outbreaks. So we are working in doing 2 main things. One is like to try to expand the access to water, like digging water wells, etc., and to toilets, as well working with the communities. But as well, we are working in cholera preparedness and response. We know, and we are coming to the season, that maybe in few weeks or in a couple of months, it's very likely we'll have cholera outbreaks because of the rainy seasons. So we need to be ready. So this year we have been purchasing like drugs, equipment, tents, beds, to be ready when cholera hits. You know, the best outbreak is the outbreak that you stop it with the first case. So we need to invest more on that, to be honest. Look, it's not easy, I have to be honest. I mean, I know that maybe a lot of people that they are looking to this, they want to become aid workers. I will encourage them. I mean, I did that. It's really, it's fascinating. It's a lot of passion. You can have a lot of impact. So it's great. So my advice number 1 is like, if this is your dream, go for it. I mean, the impact that you can have in the lives of people it's great. However, as well, it's very difficult. I have family now. I was very lucky because my wife does the same job that I do, right? So as well, she was working for MSF and for NGOs. I'm working for UNICEF and for the UN. So really, I was very lucky on that. But still, it's difficult because it means like during long periods of time, you need to be away. At this moment, my wife is responding to an outbreak in another country. She has been there for the last 3 months. I am with my 2 daughters. In the meantime, then maybe I will need to go again and she will stay with them. So the sacrifice in terms of the family are huge, but I think it's worth it if it is your passion. So my advice to the young doctors and to any other people that they are looking at us is like, if it is your passion, go for it. But you need to be aware as well of the trade-off that you will face. Look, I think to me my 2 main drivers are passion and impact, and I was mentioning that before. If you're an aid worker, you're going to work long hours. you are going to be exposed to very difficult situations. You're going to see a lot of poverty, a lot of suffering, right? So if you are not motivated, you will not do a good work. I mean, nobody does this to become rich, because you're not going to become rich, right? I have been in Afghanistan, in Haiti, in the cholera outbreaks, typhoid outbreaks, in many places, in Ebola. So you really need to like it, because as well sometimes your life is going to be at risk, right? So my first takeaway is like, this should be your passion, because if not, it's not your place to be. The second one as well, or a drive that I had during my career, is to look to the impact that you can have. And that's why I'm in Nigeria at this moment, because Nigeria is a country where at this moment for UNICEF, we have identified 9 million people in need. And more than 5 million of them are children, right? So that's a massive number of children and women that they can benefit if I do my job right, if we mobilize the resources, if we are able to set the projects and interventions soon, to help the government to make it sustainable. So really the impact that you can have here in Nigeria is massive. So this has been one of my main drivers to come here, and during all my career. Every time that I saw a crisis, I jumped into that, right? I did COVID before Ebola and any other outbreak, because I think as well it's our duty as medical doctors.